The Uganda Nurses and Midwives Council UNMC is 100 years old, a journey that began during British colonial rule in 1922, a journey of transformation and achievement in the nursing and midwifery professions.
It is extremely important to remember that the backbone of healthcare services are the medical workers, and the health professionals in this country have come a long way, both in development and also in enhancing services. The nursing profession, meaning both the nurses and the midwives, make the bulk of the health workforce in this country. And therefore, it is extremely important to take note of the 100 years that they have come, but also 100 years of development, 100 years of expansion, 100 years of service provision and saving lives.
The oldest existing professional medical body, the Uganda Nurses and Midwives Council UNMC, was set up by a colonial ordinance to train, manage and regulate nurses and midwives in the country.
At the time of its inception in 1922, the only highest qualification they had was an enrollment program, which is, in our qualifications framework, we see as a certificate level program. It is only much later that they were able to start the diploma and then the degree program.
The council has the upper arm in regulating the services. And then the Department of Nursing is also to make, both of us actually make policies, but we make policies, we make guidelines as a ministry, and then we also do technical support supervision.
Following independence in 1962, one of the key achievements of the UNMC was the indigenization of training and management of the profession. The program to localize nursing and midwifery was important. It led to the repeal of the Midwifery and Nursing Assistance Ordinance of 1922. The Nurses, Midwives and Nursing Assistants Act of 1964 introduced the new categories of nurses that could practice in the country. As a result of this, the first nurses and midwifery training school in Uganda was started at Mengo Hospital.
Over time, with the involvement of the profession, the training started in Uganda, starting with the Mengo, and then it went on throughout the country, establishing schools. We were able to acquire more skills, better knowledge, well informed, and marketable within the region and world over.
The Act of 1964 further consolidated and increased the responsibilities of the Uganda Nurses and Midwives Council. Besides regulating and supervising the profession, it empowered the council to develop the curriculum and be responsible for nurses' training and education in the country.
The Nurses and Midwives Council has played a big role in the evolution of nursing and midwifery in Uganda because they have been participating in the training of nurses and midwives in this country by regulating the curriculum. We participate in curriculum development. We also oversee the training. The health training institutions are supervised, and we also give advice pertaining the training. Then when it goes to practice, we make sure that the people who are going into practice are safe because we do the registration, we do renewal of their licenses to make sure that they are up to date.
With growing needs and emerging challenges in the medical profession, the 1964 Act was repealed and replaced with the 1996 Nurses and Midwives Act. The Council, previously a department of the Ministry of Health, could now operate and run its affairs with full autonomy.
It establishes the positions, it establishes the structures at the Council, it establishes the management, it also establishes the governing council, which guides the registrar and their deputy or his deputy in the day-to-day management of the council. So you can see that the systems are being established here, unlike before.
Brother Wakida did a lot in putting in place what we call structures in terms of providing for the departmentalization of that organization. Means right now when you go to the Uganda Nurses and Midwives Council, you find those several departments, finance and administration, quality assurance, you find the inspection department. So it was really very good.
There are many things that I think we managed to achieve. One, so we ventured into developing a 5-year strategic plan. That strategic plan helped us now to expand the structure of the council, to hire more people, to open up some departments.
The Midwives and Nurses Council has attained greater milestone in strengthening regulation. They have been participating in working with the Ministry of Education to ensure that the training schools of nurses meet the standards. They are also enhancing digitalization process to be able to capture all the information of all their nurses. Digitalization is very, very, very important because then it will bring efficiency, and people who want to verify there and then you punch in the information, you are able to tell whether the nurse is registered or not. But also those that will require their registration process done, it can be done online, and that process could be completed in time, unlike before where people would take even a year or more waiting to be registered. I think they have bridged that gap. They are able to register people as soon as they finish, which is a very good thing.
The 1996 Act further paved way for new categories of nurses and midwives, specializations and training up to graduate PhD level in a bid to improve standards of practice.
I had to check all training schools. At first, the nurses bali amasomero 9 and midwifery about 11.
We also were interested in not only in the education, but the professional practice as well as research. We still needed the enrolled nurse as a backbone of the practice in the nursing of the sick. But we felt that the registered nurse programs should be also strengthened.
So in 1993, we started the Bachelor's of Nursing Science at Makerere University. First we did the curriculum, and then we started teaching. We started with the diploma holders who would spend 2 years to finish, and then after 3 intakes, we ventured into admitting direct entry for 4 years.
The 1996 Act, first of all, brought on board the new qualified nurses and midwives. It allowed embracing the new graduates. We are seeing it addressing registration of bachelor's nurses, opening up for any other qualified nurses that come in play. So with that amendment, we are able to recruit on those other cadres that qualify who were not catered in the previous acts.
In the past, the Nurses Council was the maximum was a diploma. Okay? The Nurses Council over the period have managed to push. They have degrees, they have master's degrees, they have PhD. It is improving quality of care.
It further widened the scope of nurses training to include several areas of specialization.
We have public health nurse, we have a registered sick child nurse, we have a registered nurse, we have a registered midwife, registered mental health nurse, we have tutor nurses, we have tutor midwives, we have registered comprehensive nurses, we have bachelor's science midwifery, bachelor's nursing science, we have master's nursing science, we have enrolled nurses, enrolled midwives, enrolled mental health nurses, enrolled comprehensive nurses, and we have PhD holders.
When you are in Heart Institute, you cannot have an ordinary nurse. So the Nurses Council has first of all encouraged people to study, because we have asked that we need those type of people.
Right now, what government is looking at is specialized nurses, just like in any other profession. And the nursing profession is quite huge. So would have specialties similar to the various specialties that other medical professions have.
The 1996 Act consolidated nurses' education and training to the Ministry of Education and Sports, leaving the Uganda Nurses and Midwives Council to play an advisory role on the curriculum and training needs and standards.
Up to 1998, training was under the Ministry of Health. However, through that, a committee for which we call the Interministerial Standing Coordination Committee was formed. And again, the Professional Council, now for this case, Uganda Nurses and Midwives Council, are part of it. The Ministry of Education and Sports, especially the Department of Health Education and Training, is responsible to see that we train well, competently health professionals in the field of nursing, midwifery, and allied health professionals. And to ensure standard, it starts from recruitment until they qualify.
Once the Ministry of Education has identified the correct students to be taught in those schools, then we give them NISIN number. That means nursing student identification number. The student has this number from the beginning up to the end of the course. When they go for registration in the Nursing Council, they request for the NISIN number.
Working with the Ministry of Education and Sports, the Uganda Nurses and Midwives Council now has a robust vetting system set up through USAID funding. Under this system, UNMC has digitized all the records of nurses since 1975.
We work together with the Nursing Council to establish a human resource information system which will enable them to effectively manage records of their professionals, which, as you know, is the largest among the health professionals. Managing the details of each individual nurse and midwives required a robust data management system. They used to use folders, paper files, and of course some would get lost, some were difficult to trace. If you ask them how many nurses do you have in the country, they wouldn't easily tell you because they would not be able to compile. And yet many of the departments of government depended on the council for such information.
This robust information system has eased the process of monitoring and evaluation, as well as quality assurance throughout the nursing profession. It is also a critical system for nurses that venture into research. Indeed, the profession of nursing and midwifery continues to grow. One of the accomplishments has been the development of the scope of service. This has defined clear career paths in the profession which were not there before.
Our part as Governing Council, we already approved it and it is due for signing. And I believe that will be the act for this year, that Uganda Nurses and Midwives have a scope of practice.
Because not only does it create promotion or growth in their career as nurses, but it also motivates them because it gives you a clear, pathway to follow. And so we want to ensure that this scheme of nursing is implemented.
I owe it to the Uganda Nurses Council and Midwifery that has given us a career pathway of how we can develop nursing to a PhD level. For me, I started as a diploma in nursing, That's where I started from. And with time, the Nurses Council developed a career development career pathway, and that's when we all started going to go for a degree in nursing.
Nursing and midwifery are the frontline roles in any health facility and hospital. Thus, standards and quality of service are paramount for both the professionals and the patient's survival. This relationship ensures that medical facilities get accredited personnel and are themselves properly accredited.
We have a professional relationship with Uganda Nurses and Midwifery Council during the recruitment time and the ongoing checkups to ensure that the people working with us are truly qualified.
You must get permission from the Uganda Nurses and Midwives Council. You can't work without their license. Even the certificate, when you have qualified, they are the ones who confirm that this is a true qualified midwife or this is a true qualified nurse. She has gone through the training of either a nurse or a midwife. So we can't work without them.
The Uganda Nurses and Midwives Council has endeavored to see that the standards in use in Uganda are benchmarked on global and regional bodies. This means that the qualifications in Uganda must be acceptable internationally and regionally.
Whatever we advise the training institutions, the regulation, it is in line with what is required internationally.
When we talk about regulation, the Uganda Nurses and Midwives Council, together with Hexacon, are interested and are particular about standards of practice. Now, there are also standards of education. Hexacon tries to ensure that there is a code of conduct for nurses and midwives. But Hexacon is revising the regional code of conduct, which will be cascaded to all countries.
Additionally, international partners such as the Royal College of Midwives and Commonwealth Nurses and Midwives Federation have supported the Nurses and Midwives Council to strengthen regulation, education and professional associations in order to address barriers and challenges to the profession.
In 2015, a needs assessment had identified a theory-practice gap in midwifery education in Uganda, resulting in practitioners who were not fit for practice at the point of registration. The Uganda Nurses and Midwives Council requested technical assistance from the Royal College of Midwives to help develop a national standard for midwifery mentorship, to develop and pilot a programme to train midwives as mentors, and to address barriers to learning in clinical practice sites. This resulted in what became known as the Momentum Project. Momentum achieved its stated objectives. A national standard for mentorship was developed with the Uganda Nurses and Midwives Council and was recently validated for use with both student midwives and nurses.
And from 2011 to 2017, I was privileged to work closely with the UNMC as part of the African Regulatory Collaborative for Nurses and Midwives. This initiative, funded by PEPFAR, made available small grants to country teams of nurse and midwife leaders to conduct projects to strengthen nursing and midwifery regulation in their country. This leadership group was called the Quad. The UNMC led the Ugandan Quad successfully in applying for 3 grants. The first 2 grants in 2012 and 2013 were to develop a scope of practice for nurses and midwives.
UNFPA has been really supporting to ensure that the regulatory functions of the council are good and are working well. We have supported Uganda Nurses and Midwives Council to develop what we call the Geographical Information System for nurses and midwives. So the Geographical Information System enables the Uganda Nurses and Midwives Council to track the presence of the nurses and midwives at their workplace, but also tracks the validity of their license to practice, but also tracks of those who are about to retire, and in so doing, they support or they provide evidence for better planning for nurses and midwives' health workforce.
In terms of administration, the Uganda Nurses and Midwives Council has continued to evolve in order to be more effective in its role. From a department at the Ministry of Health headquarters to an autonomous organization with its own home, the council now has regional satellite centers aimed at improving service delivery. The regional satellite centers are located at the regional referral hospitals.
It started in 2013, and there were 3 hospitals which were selected. The Mbara Regional Referral, Mbale and Gulu. Because initially the nurses and midwives used to go to Kampala to renew their licenses, which was really cumbersome. But now, since the center is here, it's easy, and actually we collect the papers and take them to Kampala for certification and also for renewal. We also do supervision and in the region, in the healthy facilities, and also in the training school.
We are the heads of the nurses at district level, and in the process of decentralization, we have a role to play. The role that we have is to ensure that, 1, the professional standards are adhered to. 2, we have a role to ensure that service delivery are provided. 3, we want to ensure that ethical code of conduct and standards are abided to.
A robust online system has also been installed for further ease of access to the council's services. It also offers portals for registration and enrollment for fresher and upgrading courses.
So we are now designing an online system, and we have tried even to orient some of the nurses, especially the top leaders, on how the online system is going to work. And we are planning to train other users of the system to make sure that every transaction that was physical at the UNMC Council can be done online.
Over the past 100 years, the Uganda Nurses and Midwives Council has progressively made its footprint and mark on the growth and development of the nursing profession in Uganda. It has aligned Uganda to internationally and regionally recognized standards of training and practice. Above all, the Council has earned professional respect for nurses and midwives from other medical professionals.
By then, it had been only medical doctors to head the council. Up to 1998, it had been medical people, medically qualified doctors to head the council. So I became the pioneer nurse to head that council. We faced lots of challenges for medical doctors who tended to look at us as a lower level and probably an inferior group of the health professionals in general.
But there are still outstanding challenges that still need to be addressed. Some of them include how nurses and midwives can best respond to ever-evolving advances in medical technologies and practices and new pandemics and diseases.
We want to see our training schools come up with more specialized courses for nursing, and this includes the intensive care unit nurses. During the pandemic, we definitely had a challenge, and one of the things that we did was to have short courses for training nurses on intensive care unit management.
As a regulatory body, we do not work alone. Through our arm of leadership, in collaboration with Ministry of Health, Some nurses and midwives have specialized in critical care, and we have also graduates at master's level who are critical care nurses.
The journey to the next 100 years presents some unique opportunities to harness solutions to the challenges of the first 100 years.
From 100 years, let's now develop a vision for the nursing and midwifery profession.
No doubt, the last 100 years are humbling. From beginnings to regulate and supervise certificate nurses, the Uganda Nurses and Midwives Council has now grown into a powerful organization. Not only that, an organization that is now capable of setting standards from certificate level through diploma to bachelor's degree, as well as master's and PhD graduates.
As a registrar, I promise that I will be able to work with everybody, nurses and midwives, PhD up to certificate, to make sure that our profession is indeed a noble profession, to love and serve for God and my country.